Today's lesson is about regions of the body. So we are continuing our orientation of the body to include the regions. And this corresponds to page 20 in your trail guide book. So I'm going to go ahead and start the screen share. You have a Word document that corresponds to this lesson. It just says regions of the body, and it will be below or right below this video in your module. So we have regions of the body, and we start with an anterior view, which is this view right here. You're looking at the front of the body, that's anterior. And then we have a posterior view, and that's this view right here. And they don't show up on the screen all together. So again, you can just reference page 20 in order to see the whole thing. So the first thing we're going to start with is the facial area. So the facial area is, as you can imagine, the face. So it does not include the rest of the head. It's only the face. When we start talking about the bones of the skull, we'll talk about facial bones and we'll talk about cranial bones, and they are separate. So this is the facial area. Within the facial area, you have the mandibular area, which is this right here. The mandible is your jawbone. So the mandibular area is really just that jawbone area. You have a supraclavicular area or region. Supra means what? From our med terms, what does supra mean? Yes, above. That's right. Supra means above, and clavicular refers to your clavicle. This is your clavicle. It is your collarbone. That's the layman's term for it. Right there, that's the clavicle. So supraclavicular means above the clavicle. You also have a pectoral region. This is really the anterior chest here. Your pec muscles are very large and they take up most of the anterior chest wall. So that's the pectoral area. Your axillary region is your armpit. This is the axilla. We do refer to the axillary area quite a bit because there are blood vessels, lymph nodes, and nerves in that area. The axillary area is an endangerment area. And what that means in massage therapy is that we need to be very, very careful when massaging in that area. And you're probably thinking, why would we massage somebody's armpit? Well, we don't technically massage their armpit, of course, but there are muscles that connect from places on the anterior chest to places on the arm. And if we're massaging the whole muscle, we're going to be around the axilla. So we need to be careful working around that area. The arm itself, the upper arm, is called the brachial region. And a lot of the other structures in that area are called brachial something. Like you have your brachial artery in here, you have your brachial veins, you have your brachial plexus, which is a nerve group. So they're all named for that upper arm area. You have a cubital region. Cubital region is your elbow. And then on the opposite side, on the anterior, you have an antecubital region. Ante means before. So this section of your arm is before the cubital region. So it's an antecubital region. And the antecubital region is also an endangerment area. Any place where you have a bend is usually an endangerment area because the skin is thinner there, there's blood vessels, nerves, and things that are closer to the surface. So the antecubital space is an endangerment region as well. You have an abdominal area. Of course, you know where your abdominals are. Abdominal area is really this area here. And we will have regions within the abdominal area that are more specifically defined, but for now, it's just going to be this area. Inferior to the abdominal region is the inguinal region. Inguinal or inguinal, sometimes you hear it pronounced. Your inguinal region is only, let me draw something in here, is only this area, okay? It's basically where you make a bend at your hip. You have an inguinal ligament that runs this way. You have inguinal lymph nodes in this area, and you have the femoral artery that runs down like this through this area. So the inguinal area has a lot going on there. Clear my drawings here for a second. But we also have hip flexor muscles in the inguinal area. So we will be working in this area right in here for hip flexors later on in the program. But that is the inguinal area. Of course, the pubic area is where the genitals are and the pubic bone is. And if we come across here, this is the palmar area. Of course, this is the palm of your hand, right? The palmar area. That makes sense. All right, moving inferiorly, we have the thigh, which is the femoral area, and it's the femoral region or area because the femur runs the length of that area. So the bone that's in here is the femur. Our knee, or kneecap, I should say, is the patellar region because this bone, the kneecap, is called the patella. That's the name for it. So that's the patellar region. The lower leg is the crural area. And it's fun to say, crural. It almost sounds a little like you're drunk, crural, because there's got those R's in there. But the crural area is the anterior lower leg. And of course you have 2 bones and some muscle right here. If we move inferior to the crural area, we have the dorsal surface or dorsal region of the foot. The dorsal region of the foot refers to the top of the foot. So we're talking about the part of the foot that's facing towards the sky. That is the dorsal surface, not to be confused with the plantar surface, which is the underside of the foot. The plantar surface is the surface of the foot that touches the ground, okay? So dorsal surface and plantar surface, they're opposite sides of the foot. Okay, so we move on to a posterior view. And now we're starting at the head and working right down. We have the cranial area. The cranial area is the skull, what we think of as the skull. So it's the bones that encase the brain back here. The whole head, on the other hand, is called the cephalic region. So all of this, looks like I'm voguing, all of this is the cephalic region. Okay, so remember we had facial, we have cranial, but the whole thing is the cephalic region. Next, we have the cervical area. That is your neck, from here to here. The cervical region contains the cervical spine, and there are 7 vertebrae in the cervical spine. So we're really talking about the region from cervical vertebrae 1 to cervical vertebrae 7 and everything that's around to that, okay? We have the acromial area. The acromial area is very specifically the top of the shoulder here. And that's because you have a bone right here. I'll knock on it so you can, right here, it's called the acromion process. You will learn all of the bones and bony landmarks in later lessons. But for now, Just know that you do have a bone up here called the acromion process. It's at the top of the shoulder, and that's the acromial area. We also have a scapular region. The scapular region is really just the little area of the scapula itself, and the scapula is your shoulder blade. So if I put my hand on my scapula here, that's my shoulder blade, that's the scapular area. Next, we have the thoracic area, and the thoracic area is the area between the cervical and the lumbar area. So all of this in here, all of that in there is the thoracic area. The thoracic region, area, whatever, I use them interchangeably, contains 12 cervical vertebrae. And really is this whole thing, this whole area. It's the upper back, mid to upper back area. Now, the lumbar area is from here to here. Okay, so this is all lumbar in here, from here to here. And there are 5 cervical vertebrae, There are 5 lumbar vertebrae contained in that section of the spine. But really all of this is lumbar area, just like all of this is thoracic area. Right in here, I'm making a little triangle. That's the sacral area. And the sacrum is the next to last portion of the spine. And it actually is a little triangular shaped bone. So the sacral area is right here. And that's all that it is. So the lumbar area, kind of what goes across the low back. The sacral area is only this little triangle. Okay, so the pelvic area. The pelvic area is really talking about the pelvic girdle, which goes all the way around the hips. So the pelvic area, I'm gonna have to draw again, I think. Yeah, the pelvic area starts at the top of the hip bones here, and I can't draw, hold on, and goes around to the front, okay? Because your hip bones sit in your body right there, and they bear the weight of the entire upper body. So that's all the pelvic area. And if I click out of this here, I know it's going to be a little weird, but if you go all the way around here, that's all the pelvic girdle as well. So her hip bones come around to the front here on either side, and some of these areas overlap a little, like the inguinal area, which we know is right here, is on the anterior of the pelvic region. Let me clear these. Okay. So these are the gluteals. The gluteals are the butt or backside area. They're called gluteals because you have gluteal muscles. You have gluteus maximus, medius, and minimus here. Okay, so this is the gluteal area. If we come across to the posterior hand, we have the carpal region, which is the wrist, the dorsal surface, which should sound familiar to you because it's the same as the top of the foot. Well, that's the back of the hand as well. But on the other side, we have the palmar surface, right? Dorsal surface, palmar surface of the hand. And then our fingers are the digits. Digits, digits, digits. All right, if we move inferior to the posterior leg, We still have the femoral area right here, but the back of the knee here is the popliteal space, or popliteal. You'll hear it pronounced both ways. Popliteal or popliteal. It is the posterior knee, and the popliteal space is an endangerment area, just like the axillary area and the antecubital space. You have lymph nodes and blood vessels that are close to the surface here, and we don't push into that area when we're massaging. And then lastly, we have the sural area. Sural is on the opposite side from the crural area, and the sural is basically the calf area. Okay, so it goes from the knee to the ankle. Now, you do have that corresponding Word document that you need to fill in, and maybe you can do that while you're watching this video, or do it afterwards, see how many definitions you remember, or see if you can recall where each of these places are. But you do need to fill out that Word document, okay? All right, that's it for this lesson.